Today I will be sharing the best decision of my life ever, which is to do Lasik. So today I'm going to share with you guys everything about Lasik, okay? Everything from where I did it, how I did it, how painful was it, how much is it, everything, okay? And if you have any other questions, just let me know in the comments down below and I'll answer them, okay? Kristen was the one who requested for this video, which is for me to share my Lasik experience, and here I am sharing it with you guys right now. So first things first, I need to tell you guys something that is abnormal about my Lasik experience, which is I didn't take any painkillers, okay? Any painkillers, because I'm allergic to painkillers. So I wasn't prescribed any painkillers at all. So most of you guys who are not allergic to any painkillers would be given painkillers to subside the pain. So the pain that I'm describing today, it's very much the real pain that you will be experiencing if you did not have any painkillers at all. Yeah? If you want to know why I went through Lasik, you can find out about it right here in my Taobao contact lenses haul video. In that video, you can find out my history with contact lenses, with eye infections, and how I got banned. My Lasik was done with Dr. Lee Hong-Ming from the Lee Hong-Ming Eye Clinic, but I think that they just changed their name to Asia Pacific Eye Clinic. So Dr. Lee is quite a famous surgeon in Singapore that does Lasik, and yeah, so I decided to go to him because my friends all recommended him to me, and not just one friend but a few friends. And I decided to go to him to just do my Lasik. So I will link their website down below so that you guys can go and check it out. If you're thinking of doing Lasik, the first thing you need to do is to go and check your eyes first, okay? Because some people, they are not applicable to do Lasik because their cornea is too thick, their cornea is too thin, their cornea is not healthy, So although I went for a checkup beforehand and I had scratches on my cornea and I had many eye infections, my eyes are still healthy for Lasik. So in the consultation itself, what they do is to do some eye tests on your eyes. The normal one where they check your degree of your eyes. The second test would be where they puff air into your eyes balls. Ugh, that is like the most hated thing ever. Every single time I go back for my checkup, I still have to do it. Oh my god, I hate it so much, okay? I went in for my consultation to see if I am suitable to do Lasik. So this checkup was only done on my consultation checkup and also on my 6 months check-in checkup. I would think that this is to scan your cornea, because what they ask you to do is to open your eyes really wide, and you'll be looking at like this light, and this light will be like shining from left to right, and you have to leave your eyes open and you can't move your eyes at all. I don't know what that does, but I would guess that it's like cornea scanning. So after that, I went to consult with Dr. Lee. Dr. Lee would do a more physical examination of your eyes, your cornea, with like the less digital version of the cornea checking thing. It's basically a machine where they shine light from left to right of your eyes. You can literally see like a flash of light just going left and right, while Dr. Lee will be looking through like a microscope or something to see your eye and your cornea. Yeah. So during that consultation, Dr. Lee would actually let you know whether you are suitable for Lasik and which kind of Lasik you are suitable for. So some people are not suitable for the normal kind of Lasik. He will also let you know the kind of duration that you are looking at, when is the earliest you can do your Lasik, how much is it gonna cost, what is the medications cost gonna be. So he will let you know the total cost of it, including all your checkups as well. So that would be the final amount that you are going to be investing in. This was the brochure that was given to me. Okay, so this is the full price list of everything. So the pre-Lasik assessment which I did on the first consultation was $210. Okay, there is standard Lasik, there's Epi Lasik, there's Lasik Extra, and wavefront customized Lasik. So I did the wavefront customized Lasik, which was about 2.6k per eye. So it came up to be about 5.5, including like medication, consultation, the final Lasik process, and all your checkups. Of course, 5.5k is not a cheap number, but it hurts for me to pay that amount, but it's okay because at this point in time, I feel like I have no regrets of paying that 5.5k. And yeah, after the consultation, if you are eligible to do your LASIK, that's good because you can have perfect eyesight really soon. Oh, can I just say that Dr. Lee has done so many people, so many people, and all my friends up to today, their eyes have not deteriorated yet. So there are side effects of LASIK which Dr. Lee would actually translate it to you. Later, I will also be sharing my side effects that I've experienced in the video later. Okay. After that, I was very excited because I really thought that after all the shit that I went through in my eyes, I wouldn't be allowed to do LASIK. But I was very happy that I could. So I quickly went to the nurses to reserve the date for my op. So I booked my LASIK for like 2 weeks later. I was just very excited, so I just went 2 weeks later very excitedly to go down. So the nurses were given you like brochures for you to read up before you go for LASIK, because these are very important points for you to learn about pre-LASIK and also post-LASIK, so that you take care of your LASIK eyes properly, because it costs 5.5k, okay? 2 weeks later, on the day of my surgery, I done it 6 months ago, so I'm just like letting you guys know the important points, what you guys need to know on the day of the surgery. So if you're wearing contact lenses, you're banned from it like 7 days before, so you need to wear like specs 7 days before your surgery. So on the day itself, you are not allowed to put any makeup at all. I mean, duh, right? Even sunblock, okay? So sunblock is also not allowed because they don't want any kind of substance on your eye area. Last but not least, you need to bring a pair of sunglasses. You'll be dilating your eyes with eye drops, and this dilation is way more intense than the one in your assessment. Okay, this one is very real. I'm telling you right now first. Okay, so bring sunglasses and make sure that you have somebody with you, because you literally need somebody to like walk with you, because you probably can't really see the road very clearly. On the day of the surgery, okay, so the first thing that they do is to dilate your eyes with eye drops, and they move you into this room where you can take a rest for like 10-15 minutes for the eye drops to take effect. And after that, you will be moved to another room, which is the waiting room. So in the waiting room, so Dr. Lee will come in and Dr. Lee will share everything about the process. He will share with you what you can expect during the op itself, after the op, side effects, medication. You will have already been very informed about your LASIK and what you're gonna go through in the next 20 minutes. At that point in time, you will be asked to wear scrubs as well. So like, you know those things that the doctor wear, like to hold your hair up, to wear those sterile blue color clothing. So after that, you will be ushered into the op room where you will see this very mega big, very intimidating machine. There was a very loud machinery sound, like that kind of sound. And to be honest, when I stepped into the room, I was legit a bit scared. Like, I had half a mind to ask my mom to come in with me. But so in the center of this whole machine, there will be a bed for you. I wouldn't even say bed, it's like just a lying down area, okay, where he can operate on your eyes. So you're asked to lie down on the bed, where all these machinery is on your left and your right and all that. Oh my god, I tell you. Okay, so Dr. Lee is a very calming but yet serious doctor. You are probably panicking because you don't know what is happening, but Dr. Lee will give you a very strict warning on what you need to do and make sure that you do it. It just gives you a sense of fear that you don't want to fuck up your eyes. So it started on my right eye. What happened was he opened up my eyes and then he put something into my eye to open up my eyelids, and I basically couldn't close my eyes at all. Like, at that point in time, I just lost everything. And at that point in time, they also helped me put numbing drops on my eyes. Oh no, actually, my bad. So the first drops that they gave me before my rest, my 10-15 minutes rest, was my numbing drops. And the drops that they were putting during the op was my dilating drops. And then they also added on some numbing drops at times to help me ease the pain on my eyes. So at times I felt a stinging sensation, and at that point in time they would actually add numbing drops for me. Basically what happened was he told me that I'm supposed to look at a light until the treatment is done, and I did just that. But you guys need to know that it's very difficult to look at the light, okay? The first light was basically to laser out like your flap, and that one was not as bad. Sometimes it was hard to focus on it because the light was just moving and like you couldn't really control your own eyes. At that point in time, it was quite a scary thing because the machinery was rumbling as well. Dr. Lee opened up the flap and you couldn't really feel anything. You can see it happening because it's like on your eyeball, but you can't really feel anything. You cannot feel anything at all. He moved my chair to another machine, and this machine was the one that started lasering. And this one was an even scarier experience. You are looking at this light and your vision is totally clear, okay? Like, it's totally clear. After that, your vision on the outside starts to become black. So that happens from the outside all the way in, and 5 to 10 seconds later, you can smell your cornea burning, okay? You can smell the chao ta smell. Again, it's a struggle to look at the light. You just can't control your eyes at all. The light just keeps moving, and then at the back, Dr. Lee is like, look at the light, look at the light, look at the light. I'm like, I'm trying. And that was like about 30 seconds maybe. He will count down for you as well. Okay, 10 seconds more, okay, 5 seconds more, okay, you're done, you know? And like, I mean, that's quite motivating, and yes, I mean, it helps. And what happens now is he will flap back your flap. When the flap comes back, suddenly your vision is like better. You can literally see him painting your eyes, because what he's trying to do is to remove the bubbles in your flap so that it closes off nicely. Yeah, it was just like that. So that was just one eye. So it happened on the other eye similarly. And then after that, I was done. The most scary portion of this whole experience is the fact that you are not in control. You are not in control emotionally and physically, because emotionally you are listening to all these sounds and Dr. Lee is like scolding you from the back and everything is just like panic mode. And physically, because at times you just feel so much uncomfort in your eye and you can't really control your eyes. After that, when I stood up and I started walking. Holy shit, man, like I can see the road, you know, I can see where I'm walking, I can see the door, I can see the doorknob, you know, I can see everything. And I was like, holy shit, like my life has just became like 100 times better. So at that point in time, I was like very happy. I was like, oh my god, I can't wait to go home and sleep, and like, and I wake up and my eyes will be great, you know. But after the surgery, what they would do is to give you eye shields. So eye shields is basically like a plastic cover that holds onto your eye, which you need to tape on when you sleep so that it does not move your flap around. They will also give you a care pack with like medicated drops and also eye drops that you need to drop every 2 to 4 hours if I'm not wrong. The difference between mine and everybody else's LASIK is that I didn't have painkillers, and that was the most important thing ever because it hurt so much after that. On the cat back, that was like maybe 20 minutes after the surgery, the pain started kicking in. So the pain was kind of like people cutting onions. You know, when they start cutting onions, you feel a sting in your eye, you start tearing. So when I was home, the pain was even worse. If I'm gonna describe it right, I feel like it's people putting onions in your eye. Like those cut onions, those people who have cut onions, they took the onions and they stuff it in your eyes. And that was the kind of pain that I was experiencing. I was just crying out loud. Like not even like just tearing, I was just crying out loud, I was screaming. It was really very painful. Like I don't know how to explain to you, but it's very painful. So I cried myself to sleep basically. Okay, I was not allowed to touch my eyes, but at that point in time, I just couldn't take it. So I started like rubbing my eyes because it was so painful and I shouldn't have done that. But luckily, the recovery was still okay. And when I woke up, everything was better, but I couldn't open my eyes. So I basically ate my dinner while closing my eyes and then I went back to sleep. I basically slept like for 2 days straight. I just woke up a few times a day to put eye drops. Like I didn't know that it was going to be this painful going in, because all the reviews that you've seen online and everywhere about how they describe the process is with painkillers. So they don't really feel much pain. You just pop a painkiller and just go to sleep, you know. So if you guys are allergic to painkillers, just make sure that you guys are prepared for the pain. So you are not allowed to put any eye makeup for 1 week, and you are not allowed to go swimming for I think a month or so, because you don't want any bad things to go in your eye. And because it's still a wound, Dr. Lee wants it to recover nicely before you start putting all these things. After the op, I had to go back on the next day for a checkup to see how my eyes were doing. So Dr. Lee checked on my eyes and see whether I'm recovering well. I had checkups for one day, 1 month, 3 months and 6 months. So I recently just went for my 6 months checkup and I'm totally recovered now. I don't have to go back for checkups anymore. The only side effect that I have is my eyes get more tired easily. So this was one of the side effects that I've experienced in the long term. I had one short-term side effect, which was the halo effect. So the halo effect is when you look at light sources and the light sources would be very widespread, like it's glowing. Dr. Lee said that it's a very normal occurrence. So if you experience that, don't be worried because the total recovery time that you are looking at is about 6 months. So within the first few months, if you are experiencing any side effects, don't get worried because it's normal. But of course, if there's bleeding, there is like weird pus coming out of your eyes, please go and see the doctor because that's not normal at all. That was about it. So 6 months down the road, now I am a very happy woman with very clear eyesight. Yeah, I really did not regret a single dollar in this whole process because now the life that I'm living is a lot clearer. The life that I'm living is a lot more beautiful and a lot less troublesome, and that's great, okay? Yes, so I hope today's sharing was helpful for you guys, and if you guys have any questions, please just share them down below. I will just answer your questions in your comments. Thank you guys for watching as always, and love me, sub me if you want to reach me. Bye!